Welcome back to my lecture number 32. So dear students, today we will talk about the autonomic nervous system, clinical pharmacology. So in lecture 31 I have already discussed about the nervous system, the autonomic nervous system, basic pharmacology. So today the topic which I am going to present, that is the actually the organizations, the classification of nervous systems. So nervous system is classified into two categories. One is central nervous system and the second one is peripheral nervous system. What is central nervous system? So central nervous system, it includes brain and spinal cord. Central nervous system, it is the integrative control center, which I have already explained in lecture number 31. While the peripheral nervous system, as it contains peripheral nerves, peripheral nervous system contains peripheral nerves, cranial nerves and spinal nerves, the communication between central nervous systems and body. Further, the peripheral nervous system is classified into two categories. One is sensory and the second one is motor division. So these are the two divisions. Sensory division is also called afferent division, and it sensory division, it is start from A, and the motor division, it is started from E. So this is afferent and this is apparent. So sensory is afferent division. So what is sensory division? Actually, sensory division is composed of sensory neurons, which can conduct the signals from receptor to the central nervous system, while the motor division is also called efferent division. So it is composed of motor neurons, while the sensory divisions contain sensory neurons, and the motor divisions are the motor neurons. They are responsible to conduct the signals from central nervous system to the effectors. Now, what are effectors? Effectors are muscles and glands, while the sensory neuron, it can carries or conduct the signals from the different receptor to the central nervous systems. Let's see. Motor division, it is further divided into what is autonomic nervous system, the second one is somatic nervous system. So autonomic nervous system actually is that nervous system which are not under the control of will, and it is just under this is involuntary, at control involuntary response. So involuntary response, they are under the supervision of autonomic nervous system because this is automatic and we are unable to control it. While the second one is somatic nervous system. So somatic nervous system is actually the somatic nervous system is responsible to control the voluntary movement. For example, muscle of the skeletal muscles movements, voluntary muscles which are under the control of our wills. Tendons and ligaments, so they are under the control of will. So it means that they are under the control of somatic nervous system. Further, the autonomic nervous system, it is divided into two. One is sympathetic nervous system and the second one is parasympathetic nervous system. Dear students, one thing I will tell you, first of all, you will have to clear the basic concepts, how the nervous system is divided into different parts, and then the different type of drugs that can act on the central nervous system and peripheral nervous system. So first of all, you must will have to know about the anatomical location and the basic physiology of the nervous system. That's why I am focusing that autonomic nervous system is further divided into two. One is sympathetic nervous system, the second is parasympathetic nervous system. The sympathetic nervous system, actually this system mobilizes the body system, fight or flight responses. They are under the control of sympathetic nervous system. It means that whenever a person becomes aggravated, or whenever a person is in frustrations, or a person is in anger, so at that time the sympathetic nervous system is stimulated, while the second one is parasympathetic division. So a parasympathetic division, it just conserves energy, and parasympathetic nervous system rest and digestive response, they are under the control of parasympathetic nervous system. So I can give you multiple example. Let's suppose a person is in prostrated mood. Let's suppose if a person become exaggerated, and after that he or she become relaxed. So I mean that contractions, exaggerations, anger, frustrations, or you can say when the person emotion become unable to control, so at that time your sympathetic nervous system is activated. While parasympathetic nervous system, this is just you can say rest and digestive response. The autonomic nervous system maintain the internal environment of the body, which is called homeostasis. You know, the role of anatomic nervous system and the hemostasis, it links to the specific target organ like circulation, respiration, digestion, temperature regulation, and some endocrine secretions. So this is clear that autonomic nervous system, they are also responsible to control the internal environment of your body. So an internal environment of your body, for example, blood is continuously circulates for 24 hours, while the respiration process that is continuous for 24 hours, and the digestive system, they are also working. Temperature regulation and some other endocrine function, endocrine secretion, they are also under the control of what? They are under the control of autonomic nervous system. It means that autonomic nervous system, it has the capability, it has the tendency to maintain the internal environment of the body. In contrast, the endocrine system is more organized. The autonomic nervous system, especially in periphery, the nerves, the ganglia, neurofiber, and plexus, innervates the heart, glands, and other smooth muscles, as well as the visceral organs, so they are involved. Look at here. This is the organization of nervous system. Let's start to recall your past knowledges. We know that nervous system, one is central nervous system, the second one is peripheral nervous system. So central nervous system is actually brain and spinal cord, while the peripheral nervous system, which I have already explained in detail in lecture number 31 about the nervous system. Peripheral nervous system is further divided into two. One is autonomic nervous system, the second one is somatic nervous system, and then further the autonomic nervous system is classified into two categories. One is afferent division, that is called somatic division, and the second one is called efferent division, that is called what? Which is starting from E. So that is called what? That is called somatic division. The somatic division is further divided into two groups. One is sympathetic and the second one is parasympathetic. Sympathetic is also called thoracolumbar, and the parasympathetic is also called craniosacrals. Thoracic, columbars, and thoracolumbar. So this is the main division and organization of nervous system. Now come toward the clinical pharmacology of the nervous system is the drugs, different type of drugs which acting on the central nervous system and peripheral nervous system. So the autonomic nervous systems, now I am going to explain about the autonomic nervous system. So look at here, look at the sketch. Autonomic nervous system, it is classified into two categories. One is sympathetic nervous system, the second one is parasympathetic nervous system. As I have already told you that during sympathetic nervous system, actually your fight, that is called fight and flight hormone. It means that especially during emergency, during stress, when a person is in excited state, when a person becomes exaggerated, so your sympathetic nervous system is activated. It is also called fight and flight hormone. So whenever the fight and flight hormones had become activated, it means that the sympathetic nervous system had become activated. While the parasympathetic nervous system, so it can control or mimic the activity of sympathetic nervous system. So actually this is rest condition and digest, mean cool and calm conditions. In one state, the person is in anger state, while in parasympathetic, for example, when your parasympathetic nervous system becomes stimulated, so the person become in rest, or you can say he or she can digest it. Okay, let's see now about the peripheral nervous system. So as we know that peripheral nervous system is further divided into, one is somatic nervous system, the second one is autonomic nervous system. So somatic nervous system, actually it is that type of nervous system which is under the control of our will. For example, skeletal muscles, we know that skeletal muscles, these are also called voluntary muscles. For example, plexion, extension. So the Caro movement and the straight movement of them, they are under the control. The skeletal muscle movement, they are under the control of our will. So it come under the category of somatic nervous system. The second one is autonomic nervous system. So autonomic nervous system actually it control the smooth and cardiac muscles and glands. Somatic nervous system is actually one neuron afferent limb. Somatic nervous system because the somatic nervous systems it may involve your body cells. So that's why there is one neuron afferent limb. While in case of autonomic nervous system, there are two neurons, which is two neurons there involved. So neurons afferent limb, one is preganglionic and the second one is postganglionic. Let's see this table. In this table, I have already mentioned that how we can differentiate between somatic and autonomic nervous system. So look at here, organ supply, distal most synapse, neurofiber, peripheral plexus formation, afferent transmission, effect of the nerve section. So organ supplied, the somatic nervous system, skeletal muscles are involved, which are under the control of our will. So skeletal muscles, these are skeletal muscles, these are the classical example of somatic nervous system, while autonomic nervous system, all other organs are involved. For example, let's suppose heartbeat, so they are not in our controls. The second one is distal most synapse, and somatic nervous systems we can involve the central nervous system because central nervous system it contains brain and spinal cord, so they are under the control of our will, while the autonomic nervous system it contains the outside world, outside central nervous system and the ganglia and the neurofibers. The third one is neurofibers. So the neurofibers of somatic nervous system is myelinated, while the neurofiber of the autonomic nervous system is preganglionic, that is called, it may be myelinated or postganglionic or non-myelinated, myelin sheath, so they are just around the nervous system, around the neurofiber. While the peripheral plexus formation, they are absent in the somatic nervous system, while they are present in the autonomic nervous system. The fifth one is afferent transmitter. So as we know that, so in somatic nervous system, acetylcholine they are involved. So afferent transmitters, they are acetylcholine, which is the neurotransmitter. So neurotransmitter it also come under the category of somatic nervous system. So in autonomic nervous system, the afferent transmitter is acetylcholine and as well as noradrenaline. So it is not necessary. That's why we have involved the afferent transmitter acetylcholine in somatic nervous system, while acetylcholine and noradrenaline in autonomic nervous system. Effect of the nerve sections in somatic nervous system, it cause the effect of nerve section. There may be chance of paralysis and atrophy may be occur in somatic nervous system, while the effect on the nerve section and autonomic nervous system it can actually maintain and there is no atrophy. So this was a little bit differentiation between somatic and autonomic nervous system. Now let's see, come here to autonomic nervous system organizations. So what is autonomic afferents? As we know that afferent division, one is afferent division, so one is somatic division, the second one is somatic cell division, and the second one is motor division. So this is actually the afferent. Afferent fiber from visceral structure, they are the pus link and reflex arc of the autonomic system. Most visceral reflexes, they are mediated through the central nervous system, especially the information on the status of the visceral organs is transmitted to the central nervous system through the cranial nerves, which are also called parasympathetics, and the visceral sensory system, and the spinals, especially the sympathetic nervous system, visceral afferent system is involved. As we know that the cell bodies which are located in the sensory ganglia of the cranial nerve and the dorsal root. So this is clear. The ganglion of the spinal nerves, it is mixed and non-myelinated nerve, which I have already explained. The cranial visceral sensory mechanoreceptors and chemosensory information. There are 4 cranial nerves which are involved here. Cranial nerve number 5, and cranial nerve number 7, and cranial nerve number 9, and cranial nerve number 10. Actually, these 4 nerves, they are responsible to carry informations from face, head, tongue, palate, carotid artery, esophagus, thoracic, abdominal, and visceral organs except the pelvic. The spinal visceral system, they are responsible for the regulation of temperature and tissue injury of the mechanical, chemical, and thermal origin. The sensory afferent, which is started from all the viscera at the thoracic level. The muscle chemosensations at all spine level. The pelvic sensory response at S2 and S4 levels. Now come toward the autonomic nervous system, central connections. As we know that there is no exclusive autonomic area in central nervous system. Intermixing the somatic responses always are accompanied by the visceral responses and vice versa. The automatic reflexes can be initiated at the level of spinal cord, sweating, blood pressure, alterations, vasomotor responses to temperature changes, reflex emptying of the urinary bladders, rectum and seminal vesicle. तो असल में मैं डिस्कस कर रहा था नर्वस सिस्टम के बारे में कि एक हमारे पास ऑटोनॉमिक नर्वस सिस्टम होता है, एक पेरिफेरल नर्वस सिस्टम होता है, ठीक है। तो असल में ऑटोनॉमिक नर्वस सिस्टम जो होता है दे आर नॉट अंडर द कंट्रोल ऑफ आवर विल, ठीक है। इसको हम कंट्रोल नहीं कर सकते। फॉर एग्जांपल अगर लेट सपोज अगर किसी से स्वेटिंग हो रहा है तो दे आर अंडर द कंट्रोल ऑफ ऑटोनॉमिक रिफ्लेक्सेस। अभी ब्लड प्रेशर जो है इसको हम मेंटेन नहीं कर सकते क्योंकि ब्लड प्रेशर अप डाउन इसमें फ्लक्चुएशन आता है, दे आर नॉट अंडर द कंट्रोल ऑफ आवर विल। इसी तरह वैसोमोटर रिस्पॉन्सेज टू द टेम्परेचर चेंजेस दे आर आल्सो नॉट अंडर द कंट्रोल। इसके अलावा यूरिनरी ब्लैडर्स, रेक्टम एंड सेमिनल वेसिकल, ऑल दीज एक्टिविटीज आर नॉट अंडर द कंट्रोल। Hypothalamus and especially STN in the organ to regulate the high integrated pattern of response are organized in the hypothalamus. Many autonomic centers, they are located in the midbrains, medulla limited pattern responses, like sympathetic and parasympathetic responses. So sympathetics, it may be lateral and posterior nuclei, while the parasympathetic is anterior and medial nuclei. Now come toward the autonomic nervous system, efferent fibers. So this is sensory division. So in simple words, this is motor divisions. Actually, when it is started from capital letter E, so it means this is motor divisions. When it is started from capital letter A, so in simple words, you can say this is sensory division. Motor limb, sympathetic and parasympathetic nervous system, most organs receive both innervations functionally antagonistic of each other's. Exception cases, most blood vessels, sweat glands, spleen and hair follicles. There also, these are exceptional cases. Sympathetic nervous system, for example, the gastric and pancreatic glands, ciliary muscles. As we know that pancreas, which is responsible for some particular secretions that may be in the form of insulin, glucagon, somatostatin. So these are sympathetic, it may involve the sympathetic nervous system, while the second is parasympathetic nervous system. So overall, I would like to say, overall, it depends on the tone at the particular moment summations, the exception atrial fibers, ERP reduced by the both. Okay, let's see here, dear students, this is the direction of transmissions. How these impulses, how these messages are generated, how these electric impulses they are generated, and then these impulses can move through a specific pathway. So this is the direction of transmissions. So look at here, this is what? Neurons. How the neurons can move through a proper pathway. So this is actually the direction of transmission. Look at here, this is the structure of the neurons. Look at here, these are dendrites. This is the nucleus. Look at here, this area soma, this is called somatic, this is cell body, this is axon. So axon are long, dendrites they are short, and these are, look at here, these are Schwann cells, and this is myelin sheath, this is node of adrenoids, and this is axon terminal. This is postsynaptic or signal receiving end. So I mean that postsynaptic or signal receiving end, this is responsible to receive the perception, the signals, actually when the nervous systems become activated, when the nerve firing occur, when these signals become, when these signals they are generated, when these electrical impulses are generated, and these electrical impulses they can move across from the presynaptic signal releasing end to the postsynaptic or the signal. So actually this end, as I have mentioned, and the structure of the nervous system, the postsynaptic signal receiving end. So actually this is the receiver section, and this section is called, this is postsynaptic, mean after receiving the signals from here, this is axon. So you must will have to clear your basic concepts about dendrites, what are axon, what are cell bodies, what is nervous system, what is nucleus, what is Schwann cells. So all these things have become the part of physiology. Now the postsynaptic, actually this is the place where the signals or the messages which are generated, so it will come across, especially in this direction. So this is postsynaptic or the signal receiving end, and this is presynaptic or signal releasing end. So these are the axon terminal, these are the node of adrenoid, look at the Schwann cells, and these are the axons, and these are the cell bodies, nucleus and dendrites, which are already given in the diagram. Now come toward the transmitter and receptors. So as we know that receptor, these are the drug binding sites. Pharmacologically or physiologically you can say so that receptors, actually these are macromolecules which are protein in nature, proteinaceous in nature. But here in this case receptor, these are the drug binding sites. How these neurotransmitters are released, and then these neurotransmitters can move through across a proper pathway to reach to its target sites. Okay, let's see here in general ways. Transmitter and receptors. As we know that neurotransmitters, you know, all the preganglionic and postganglionic, parasympathetics, acetylcholine. So we know this acetylcholine, this is actually neurotransmitters. So all the preganglionic and postganglionic, parasympathetic, acetylcholine. So acetylcholine actually this is neurotransmitter, while in postganglionic sympathetics, the norepinephrine and noradrenaline, so it can especially directly link with the postganglionic sympathetic nervous systems. It means that acetylcholine can follow both the postganglion and free ganglion parasympathetic nervous system pathway, while the noradrenalines and the norepinephrine can follow the postganglionic sympathetic nervous system, which I have mentioned. Okay, now come toward the somatic nervous system. You know, somatic, it may involve the nicotinic receptor, which is called NM receptor, nicotinic receptor. So this is acetylcholine type of receptor, which is also called NM. So you can say musculoskeletal junctions. The autonomic nervous system, which include the parasympathetic nervous system and sympathetic nervous system. So now when you are parasympathetic nervous system, it involves the preganglionic and postganglionics. Or what are, so preganglionic, actually the nicotinic N-acetylcholine. So actually they are formed, they are produced, they are just follow the preganglionic pathway, while the muscarinics it follow the postganglionic. The sympathetic nervous system, actually it is categorized into different categories. While here in sympathetic nervous system, the preganglionic pathway is nicotinic N-acetylcholine, while the postganglionic and sympathetic nervous system, that is noradrenergic or alpha, or you can say beta. So the adrenal medulla, preganglionic and postganglionic adrenaline and the bloodstream. Okay, now come toward the enteric nervous system. You know, enteric nervous system. So enteric nervous system is considered, this is the third division of autonomic nervous system. So we will explain a little bit discussion about the enteric nervous system, which is considered the third division of the autonomic nervous system. It controls the activities of the gastrointestinal tract and control locally, while the apparent sensory neurons and the number of motor neurons and intermediate neurons, they are organized by the orbit plexus, or you can say mesenteric plexus and masonal plexus or submucosal plexus, or they are involved here, especially in enteric nervous system. And this nervous system has been occupied at the level of intestine. So the mesenteric plexus, the contraction and relaxation occur, especially in your abdomen, especially in your gastrointestinal tract. So here an enteric nervous system, so we may directly involve the gastrointestinal systems, especially the intestine. The parasympathetic nervous system is a whole as excitatory pre and post acetylcholine, while the parasympathetic is relaxants, preganglionic acetylcholine inhibition. The stimulation of these neurons causes the release of acetylcholine, norepinephrine, and you can say many and more hormones which are released, especially in VIP, ATP, substance, P-hydroxy, 5-hydroxytryptamine. This is the innervation of the enteric nervous system. So you can see here, these are sensory fibers, and the sensory fibers, so they can directly connect with your mucosa. While look at here, this is sympathetic postganglionic fibers. So this actually this sympathetic postganglionic fiber, they are also connected here. So it means actually the nervous system, its division is just like that. The nervous system, this is upside, and these are 5-hydroxytryptamine. So look at here, these are MP, CM, SMP, and this is NM. So this is actually enteric nervous system, and this nervous system occupy the overall, the enteric, the enterons, the intestinal levels. These are 5-hydroxytryptamine, and the parasympathetic preganglionic fibers. So look at here, these are acetylcholine, and these are the you can say these are the different type of hydroxytryptamine. How these mean that how the sensory neuron, motor neurons affectors. So I mean there is just these are interconnected channels. And this interconnected channel, this is this is the third division of the autonomic nervous system, which is called enteric nervous system, which may occupy the JT. Okay, so how neurotransmissions can happen, how neurotransmission can occur. This is the basic neural process. Understanding the steps of the chemical mediation of the nerve impulses is important and exploited pharmacologically. Actually, how the conduction is occur, how the neuron they can be transmitted from one pathway from one place to another place. So here the conduction mechanisms I would like to explain. So the conduction, it refers to the passage of impulses or messages along the axon or muscle fibers. You know difference between axons. You know axon and dendrites. These are many in numbers, and dendrites these are short fibers, while axon these are less in number, and these are long fibers. How the neurotransmission can occur? So actually the conduction is it is the passage of impulses along an axon or muscle fiber. The transmission is neurohumorals. Transmission means the transmission of message across the synapses. Synapse is the gaps between two neurons and the neuroeffector junction by the release of humoral chemical messages. It means that the neurotransmission can occurs by means of across the synapses, which is the gap between two neurons and the neuroeffector junction by the release of humoral chemical messages. Initially, the junctional transmission was thought to be electrical. But Dale in 1914 and Otto Lowe 1921 provided a direct proof of humoral transmission, that there are many neurohumoral transmitters which has been identified, that neurotransmitters may be in the form of acetylcholines. It may be preganglionic or postganglionic, acetylcholine, noradrenaline, dopamine, 5-hydroxytryptamine, gamma-aminobutyric acid. So these are also neurotransmitters. Purine is also neurotransmitter. Peptides is also neurotransmitter. So all these are the neurotransmitters which has been identified. Okay. This is another mechanisms how the axonal conduction is occurs. I mean that how when the impulses become generated, so after generation of these impulses, how these axonal conduction can take place here. So as we know that during you know about the phenomena of repolarization, hyperpolarization, depolarization. So first of all we will have to clear the basic concept of the hyperpolarization, repolarization, depolarization, which are the basic concepts. So axonal conduction is occur especially when you are in at rest. So and rest at the interior of the typical mammalian axon is 70 millivolt negative to the exteriors. So it means that the especially in resting, you can say resting membrane potential and resting condition, the typical mammalian axon is more negative, means 70 millivolt, that is more negative than the exterior, than the outside environment. So that's why essentially potassiums, you can say nearest potential base they are required, and actually these ionic gradients they are maintained by the sodium potassium adipase systems. In response to depolarization to the threshold, the level at the action potential is initiated locally. It means that whenever the electric impulses they are generated, so the action potential is produced. After that, the AP, the axonals, you can say the ATPs, potassium, sodium, potassium adipase system. So it consists of two phases. The first one is, in first phase, there is rapid increase occur in the permeability of sodium ions. Increase in permeability of sodium ions mean increase the concentration, the speed, the permeability, the flow of sodium ions become rapid. While in second case, the rapid inactivation of sodium channel occurs. So while in second phase, the sodium channels it become deactivated, it become inactivated, and the delay opening of potassium channels occur. It means that in the second stage, the sodium channels it become deactivate, which may indirectly delay or slow down the opening of the potassium channels. For example, tetrodotoxin, ceccotoxins, and batrachotoxins. Look at here the junctional transmission steps. In junctional transmission steps, the arrival of the API at the axonal terminal initiate a series of events that trigger the transmission of excitatory or inhibitory neuronal junction, the release of the store transmitters, the pre-junctional regulations. The co-transmission is occurred through enzymes and other protein and co-transmitters like ATPA, adenosine triphosphate, and many more, while in PY the autoreceptor and heteroreceptor, that is M2, M4, and alpha 2A, alpha 2B, and alpha 2C. The combination of the neurotransmitter with the force junctional receptor and production of the force junctional potential, EPSP and IPSP. So all these are actually the transmission and force junctional receptor. So the initiation of the force junctional activity maybe occurs, and there will be the termination of the transmitter junction. That is called what? Junctional transmission steps. That is called NAT, ACRT, and DT. So all these are the look at here. This is the junctional transmission steps, and this is the docking mechanism, docking complex. This is synapse, vesicle, excitatory transmitter, inhibitory transmitter. You can see these are voltage sensitive sodium channel. So as I have already explained that in initial state the sodium ion channels are become activated, while in second case the sodium channels that become deactivated, which can delay the opening of the potassium channel. So that is called sodium potassium ATPase system. So one is inhibitory mechanism, the second one is excitatory mechanism. So especially an excitatory, the neurofiring is occurring, the action potential become generated, and there is occur the opening of the sodium channels. So inshallah, thank you so much for watching my lectures and your dedication. Inshallah, in my coming lectures I will discuss about the cholinergic system and the cholinergic drugs, how they act upon on the autonomic nervous systems and peripheral nervous system. So thank you so much, dear viewers and my students. Inshallah, I will continue my lecture session especially for all my students, and thank you so much for watching my lectures.